Hi there, this is Dr. Mark from the Grothman Clinic, and welcome to this session in our ongoing patient education series. Today we're going to talk about a structural problem that we find in 75 to 80% of our patients. And I'd like to discuss two portions of that structural problem that make a huge impact on lifestyle decisions. And those two things are compensation and support. Let's start by looking at each of those words. Compensation means to make up for something. You compensate because of a weakness. An example might be a blind person, and the inability to see forces that person to compensate by increasing or elevating the other sensitivities in the other four senses. The blind person might be able to smell better than a normal person, or to hear better than a normal person, because they're compensating for the loss of their vision. Support, on the other hand, is something very simple to see, and it's helping a weak area. One example of support might be two armies that are readying for battle. They're equal in numbers, they're equal in equipment, they're equal in almost every regard, and frankly, the outcome is probably a toss-up. Just before the battle, another army comes and supports one of the two armies, and together, with a much stronger force, the odds for victory are overwhelming in favor of the army that received support. In the body, we see this balanced all the time. Let's look at a person, for example, that sprains an ankle. And because of the sprained ankle, there's compensation. You don't walk normally. You shift your weight onto the good ankle to keep that weight off of there. And you try to allow the ankle to heal up a little bit. And there are things that a person can do to support the ankle during that healing process. One of the classic recommendations that we make is called RICE. Rest, ice, compress, and elevate. And this is the classic support for a sprained ankle. Once the ankle is almost healed or healed, we also want to support the weakened area, those stretched ligaments, by supporting the muscles that cross over those stretched ligaments. And so there are special ankle exercises, resistance exercises, that can be done to support the previously injured area. We can use tubing, or we can do what I call a stork stand, standing on one leg with the other foot resting against the knee. You can put your hands on your waist, you can put your hands out to the side. If you feel like doing yoga, you can put your hands over your head. But the main thing is that you're standing on one foot, making those tendons that support the ankle stronger and stronger and stronger to support the ankle, because those ligaments have been stretched and they're unable to do their job. Now let's move on from a sprained ankle to a sprained pelvis. And in chiropractic clinics all across the world, we have so many people that come in with low back pain. A sprained pelvis really is involved in 75 to 80%, as I mentioned, of the patients that come into our clinic. What is a sprained pelvis? A sprained pelvis, as you can imagine, is very similar to a sprained ankle. It's just in your pelvis. A sprain, by definition, is a tearing loose of the ligaments in varying degrees. It usually happens because of an injury, and again, because of the sprained pelvis, we find compensation and support issues that need to be addressed. Before we get into the compensation and support, let's look at some of the symptoms that might be seen in a person with a sprained pelvis. What do you think? Do you think the person might have low back pain? Of course. But as part of the compensation for a sprained pelvis. Very similar to a sprained ankle, there's a shift, a weight-bearing shift. And the second thing that happens is a tensioning, a tightening of the muscles that cross or support that injured sacroiliac or pelvic joint. Those tight muscles cause a multitude of problems, ranging from shoulder to neck, headaches, knee pain, heel spurs, plantar fasciitis, foot pain. And these multitude of symptoms can happen in the absence of low back pain. And so as a good chiropractor, as a good provider looking for health solutions, we may find that a patient, even in the absence of low back pain, needs to have the low back addressed. And then we get into support issues. What can we do to support a sprained pelvis? In our particular practice, we use a technique called sacro-occipital technique. It's abbreviated SOT. And the SOT uses some padded wedges to realign and stabilize the pelvic bones. And if you will, put those little sacroiliac joints back into their happy position. The blocking is very, very gentle, very precise. The blocks are put in a high and low position based upon the patient's short leg. And the blocking is really very quick. In the first few visits, it might cause some pressure or discomfort, but normally it's very, very comfortable and highly effective. In addition to the blocking procedures, the support might include putting an ice pack on the low back, usually 30 minutes, and usually at the end of the day. In an acute situation, multiple times a day, 2 or 3 times a day. Walking is beneficial for a sprained pelvis, limiting sitting, being careful with coughing or sneezing. Obviously, keeping core strength as strong as possible once the acute phase is relieved. Reducing body weight and reducing impact. High impact exercises, jogging and some aerobic exercises can cause a pounding and a strain and can aggravate a chronically weak pelvis. These support issues are lifestyle changes that need to be addressed as a person with a sprained pelvis. And being able to make those decisions intelligently can have a huge, huge impact on being able to maintain a chronically sprained pelvis over decades throughout life in order to keep any low back pain and, as we mentioned, any multitude of other related symptoms quiet and enjoy a nice, healthy life. Thanks again.